Most people with a straightening of the lumbar spine are not just dealing with a pain problem, they're dealing with a structural one. And that difference is exactly why so many people cycle through therapy, injections, and pain management without ever getting real correction. When your lumbar spine loses its normal curve, the spine stops handling the load that it was designed to handle. That mechanical breakdown is what drives chronic low back pain, disc degeneration, arthritis, stiffness, and eventual nerve pain. In our clinic, we use research-based lumbar extension traction as part of an advanced chiropractic biophysics approach. We help patients struggling with long-term pain and spinal arthritis restore their lumbar curve without surgery. In this video, I will show you how we do this using a 3-phase lumbar extension traction protocol. Every setup is matched to the patient's grade of spinal degeneration, flexibility, and pain tolerance. That's what allows us to introduce extension forces safely and progressively, correcting the structure rather than chasing the symptoms. Also, stay to the end because I'm going to walk you through a real patient case so you can see exactly how this works in practice. I'm Dr. Graham Jenkins. I'm the clinic director of one of only 2 advanced CBP corrective offices in Western Canada. Our 100+ living office is located in beautiful Kelowna, British Columbia. And my goal is to help my patients restore their health, mobility, and confidence through personalized, non-surgical spinal rehabilitation. And as I indicated, I'm one of only a few doctors in the world who are advanced certified in chiropractic biophysics. So that means the strategies that you will learn on this channel are literally on the leading edge of non-surgical spinal restoration and rehabilitation. The key to today's more advanced strategies for spinal correction is that the CBP approach focuses on real correction, not just pain relief. Our whole focus is to help people fix the root cause of spinal problems that have held them back for years. This channel is dedicated to giving you clear, evidence-based videos that explain how your spine and nervous system work, why posture matters, and what you can do to move and feel better naturally. If you're ready to take control of your health and start moving without fear again, subscribe to the channel. You'll discover practical, evidence-based ways to correct your posture, protect your spine, and keep your body strong for life. I upload a new video every week. Imagine with me, you've just received your X-ray or MRI report, and somewhere in the findings it mentions straightening of the lumbar spine, loss of lordosis, or hypolordosis. You're not entirely sure what that means, but you know something isn't right. And on top of that, you feel it almost every day. Back pain, leg pain, cramping, and stiffness. You feel like you're 80 and you're only 45. That finding is telling you the natural curve of your lumbar spine has reduced or flattened. But this curve is not just about alignment. It's how your spine absorbs load, distributes force, and protects the discs and nerves running through your lower back. Your MRI report may have also mentioned a disc herniation, disc bulge, or disc degeneration. And if you're like many of my patients, you're wondering if this straightening of the lumbar spine and all that technical language in your report is the cause of all your pain. I'm going to say what I say to my patients. There's a very good chance that it is. And it's been the root of your pain, stiffness, and nerve pain for a long time. When your lower back curve is reduced, the discs lose their normal mechanical support and begin to break down over time. That makes your spine feel far less durable to most of the simple things you do every day. Not just when you lift heavy things. Most people are never told that. They think that their pain is from a bad lift in the gym, or cleaning out their garage in the spring, or helping their friend move. What they don't realize is that loss of spinal curve in their lower back is setting them up for pain, stiffness, and early arthritis with every move, car ride, or activity they do. And the longer they ignore it, the harder it's going to be able to fix. As your spinal problem progresses, you may notice your back feels stiff in the morning, or that sitting or standing too long becomes uncomfortable. And that movement, which used to feel natural, now takes real effort. Some people also develop leg pain or nerve symptoms running into the glutes or down the legs. Because a flattened lumbar spine will place abnormal pressure on the nerves exiting the lower spine, and those nerves feed your lower back, your legs, and not to mention all the organs and systems in your lower abdomen and pelvis. You may have already tried physiotherapy, massage, traditional chiropractic, medications, or injections, and you're frustrated that that relief didn't last. First, please don't give up. I'm here to say, and show you in this video, there's a more strategic, intelligent, and personalized way that can help you break through and beat your symptoms. If all the focus from all the professionals you went to has been just on addressing the symptoms and not correcting the straightening of the lumbar spine, then this video will give you hope and get you pointed in the right direction. In my over 30 years of working with hundreds of patients, I have never met anyone who wanted surgery, but many of my patients felt surgery was their next logical step, especially when nothing else had worked for them. But a straightened lumbar spine is a structural problem, and a structural problem responds to structural solutions. Now let's talk about the solution. Lumbar extension traction is a corrective method used within chiropractic biophysics. The goal is not to temporarily stretch tight muscles or simply decompress the spine. The goal is to restore the natural lumbar lordosis by applying sustained, specific extension forces that remodel the spine over time. This approach is supported by published research. A systematic review of controlled trials evaluating chiropractic biophysics lumbar extension traction found measurable increases in lumbar lordosis averaging approximately 7 to 11 degrees over a 10 to 12 week period, typically delivered across 30 to 36 treatment sessions. More importantly, the randomized trials showed that patients who received extension traction not only improved their spinal curve, but also maintained improvements in pain and disability at 6-month follow-up. In comparison groups that received standard physiotherapy without extension traction, pain reduction was temporary and often regressed within a few months. Structural changes did not occur in those groups. I have dozens of patients who went that route, and I can assure you they were very discouraged by the time they found me. The addition of extension traction made all the difference because when you correct the curve, you change the movement patterns of the spine. When the movement patterns improve, abnormal stresses on the discs decrease. This will reduce ongoing disc breakdown, improve spinal mobility, decrease muscle spasm, and relieve pressure on irritated nerves that are causing pain. As alignment improves, posture and whole spine balance often improve as well. In some cases, we've actually seen degenerative discs increase in height, and that's super exciting. It's important that lumbar extension traction is introduced in a controlled, progressive way based on the patient's level of spinal degeneration, flexibility, and pain tolerance. The setup is customized so the spine can begin adapting safely rather than being overwhelmed, giving patients a true structural alternative to repeated injections or surgery. In fact, I had a patient this week start his lumbar extension traction, and when we started putting him into the position, the degeneration in his spine irritated the nerve more. So we had to modify his traction immediately. With this slight modification, he's doing better. But this case illustrates that we need to control how we start. These nerves are super sensitive and very important for your body to function. We need to be smart how we approach any case of straightening of the lumbar spine. And make sure you stay to the end because I'll share a real patient case showing how we applied lumbar extension traction and how it helped restore the lumbar curve while reducing pain and improving function over time. But first, let me explain how we apply this using a graded 3-phase traction system. So anytime we put someone in traction in office, we start them at about 4 to 5 minutes. Ideally, if they can tolerate 5 minutes on that first set, then we're in a great place. We know that we've got them on the right unit, that we're applying the right force. They'll have a fair bit of soreness that first day, but we quickly will increase that time. So next day we try for 10, the following day 15, and then we will actually just have them in traction in office for a maximum of 20 minutes each time. The only time we modify that is I do have some fly-in clients, so we'll need to do 2-a-days. So they'll actually have a total of 40 minutes a day in traction, but it's separated out by some time. They're also doing some other things like power plate to enable their body to tolerate more. So there are some strategies we do for our fly-in clients, but for our local clients, We max out at 20 minutes in order to get maximum ligament stretch. It will also help bring in some of that disc tissue as well. So when you apply that long axis traction, it actually helps some of that disc tissue go back into that disc because it creates a bit of a vacuum. The other thing that we really want to make sure when people are getting traction at this level is that they're very hydrated. So we want them well hydrated for their traction set. So there's lots of moisture in that tissue so the disc and the tissue can resorb that liquid, that water, and allow it to plump up again, because really every millimeter that we can get is taking pressure off the nerve, not only getting that curve back like we've talked about, that structural curve for the long term, but we're getting that disc higher, getting that tissue separated, and we're creating more space for the nerve. So the first consideration that we need to understand with the patient is how flexible they are. So if we have a really stiff or someone who has got really significant loss of lumbar curve, then we might only be able to start with something like this, which is a foam dome that we put under their spine when we do traction. The next level, which is more ideal, is the lumbar Degeneration, and it is specifically designed and research tested to increase the lumbar curve. So we're going to demonstrate with this, but know that there is even a beginning level. As I mentioned my patient earlier, we started them on lumbar traction with this guy, but they weren't able to tolerate it, so we immediately went to the foam dome. He should be able to graduate up to the lumbar Degeneration, but we at least started with the foam dome. So Jan, if you could lie down on your back. So get your bum here. Okay. Good. Laying down. Okay. And I'm going to have you lift up. Okay. Good. Thanks. Good. Across. Now this is something that we've added because oftentimes with the loss of the lumbar curve, people also have degeneration in their spine. So if on your MRI it's said you've got narrowing of discs or you've got arthritic changes, then this is why we add this special component that does what we call long axis distraction. So you'll notice that we've got this additional piece here. Good. And we can attach that to our unit that we have on the wall. We're not going to tighten that up because I really want to show you the lumbar Degeneration and how we make that more effective. So, Jan, I'm going to have again those feet up flat. Okay. If you want to bridge up for me. Good. Great. Good. And we're going to place that lumbar Degeneration. Okay. Good. And come on down. Great. Just relax on there. Then also going to straighten out here. You notice that we're putting blocks underneath your calves to make sure that her calves are lined up with the height of her pelvis now. So one of the really important things in the world of biophysics is that we don't cause another postural distortion by correcting the one that we're going after. So all of these straps are designed to increase the intensity of the Degeneration that's in underneath the patient. Can you feel that, Jan? Mm-hmm. Yeah, she can feel that. So this would be for someone who is quite flexible. We really don't have a lot of concerns as far as arthritis or degenerative change. And as we mentioned, we're going to do this between 30 to 36 times. We're going to reevaluate, and oftentimes in most biophysics offices that actually includes a re-X-ray. So we're going to measure again how much change we've happened in there. A lot of times within the first couple of weeks, people are starting to notice changes. So whether they're having less back pain or more mobility, they're really starting to see the benefit of getting that lumbar curve back. So this would be a unit that we would use for someone that has more advanced degeneration. There's another option that we can do with this unit where we actually have a harness completely around the rib cage and we lift, that's a case where if somebody has more advanced degeneration in their spine, your MRI would say things like arthritic changes in the spine or almost herniations, disc bulging, those types of things. That lift really helps them, just like on the Degeneration table where we do that long axis distraction to pull the pelvis down. When we're recreating the arc in that lumbar spine, sometimes there's bone spurs and osteophytes that are formed that actually can impinge the nerve more when we introduce the lumbar lordosis. So the main force for this is this bar across, and you can see here we're pulling the lower back. You just want to raise your arms up a little bit there. Yeah, I know it's hard. So there's a pull here, and I'll show you how we increase that. Can you feel that? Yeah, so we're restoring that lumbar lordosis gently. We've also got a strap across the top of the hips here that goes downward. You can see this going down here to the bottom. So that's keeping her femurs or the hip bones and everything down. And then we've got another force here that's controlling for making sure her rib cage doesn't go forward when we pull in here. So this is a really nice way to be a little bit more gentler for someone who's maybe not quite as flexible or has more advanced degeneration in their spine, but there is still a very, very effective way to restore that lumbar lordosis, get the pressure off the nerves and allow that nerve flow to get down into the legs and stop the numbness and the pain that's coming into that lower back. So this set would be for someone that has more advanced arthritic change, as well as other postural distortions that are accompanying the flattened lumbar spine. So with the RoboTrack, we can control for any sort of pelvic issue. We can also add additional traction. You can see here, we have this additional bar here that we can actually do more long axis on the neck, and we can introduce a curve correction at the same time. Again, you'll see there's some blocks underneath the calves here. Big rule in biophysics is let's not introduce another postural distortion while we're correcting the main postural distortion. So you can see here, we can bring this up to introduce the lumbar lordosis. So we could pull that quite significantly, but for this table, generally because this person's going to be more immobile and more stiff, we're not putting a lot of forces through, not like with the Degeneration table or the UTS. This one is more or less starting somebody that's got quite a bit of degeneration. And then what we can do is we can actually slowly distract. You can see the table is in two sections and the actuators underneath are actually helping me separate the spine. So you imagine if there's arthritis on that spine, plus they've lost the curve, we need to open up the spine before we can put more curve in there, because if those bone spurs or osteophytes, as they're called in your MRI or your X-ray report, those osteophytes need to be pulled apart so we have that extra range to be able to get the curve. So in this case, we can actually separate, we can actually even bring in some lordosis with this. You can see how we're lifting the head section. So we're actually increasing the lordosis by bringing the whole rib cage forward. And then we can tighten that to be more specific with this. So this particular table is the Cadillac for everything traction. As far as I know, this is the third one in Canada right now. So we really use this for people who are trying to avoid surgery or have quite a bit of arthritic change and other elements going on with their postural distortions. So far, you have learned what a straightened lumbar spine is. You also learned how we use chiropractic biophysics, lumbar extension traction to correct it. And you've seen some of the traction methods we use in our clinic and at home. Now I want to share a real patient case from our office so you can see how we apply this in the real world and what kind of structural and symptomatic changes are possible when the lumbar curve is restored properly. His name's Kevin, and he's a local mechanic. Pretty cool job. He actually works on helicopters, which is not a bad gig. So just a young guy, but over top of a workbench and extreme precision work. So that flattening of his lumbar spine when he was over that workbench was just causing an incredible amount of not only low back pain, but it was radiating down into his leg. So with Kevin, because he was younger and he was flexible, we were actually able to start him on the advanced Degeneration set. And that was really helpful for him because he was able to relax because he was laying down. Gravity was actually assisting part of the traction set. This was his home unit, the home Degeneration. So he placed that at the upper part of his lumbar curve. He was really, really straight. So when that lumbar spine and his pelvis was off the edge, it gave us that elliptical shape at the bottom 2/3, and this pushed his upper lumbar spine forward and his rib cage forward. So that was basically the main push that we wanted for him. He had some other things going on, but this was his main issue. Fast forward 2 years. Now, Kevin lost a job for a little bit and then he's back at work again. So he actually had to discontinue care for a little bit because of finances. But he came back. When we checked his posture picture, he was still holding from the several months before. So again, that's the power of this kind of work. And like we had mentioned, the research showed that we're seeing permanent ligament change up to 6 months, sometimes longer, with people who have done the actual curve correction rather than just other types of therapy alone. So Kevin's back at it. We only need to see him now a couple of times a month, which gives him a lot more freedom. He doesn't feel like he's living in the office, because when we started, we were seeing him twice a week in the office, that we were doing his traction in the office, as well as some mirror image exercises, things like that, and his home Degeneration. So all of these things stacked to ensure that he was getting the kind of curve correction that would give him the kind of permanent change. Fast forward to today, we just saw him this week. He's doing terrific. He's working more hours now than he ever has, and his lower back is staying really stable, no leg pain, and he's actually able to get back into some of the extracurricular activities. He's a big backcountry guy, so he really demands a lot out of his body. So when he's out in the backcountry, whether that's on a set of skis or doing some insane hike out there, his spine is handling that kind of load, whether it's a backpack or sitting at work. This is the really exciting thing for me, is that I get to see people get back to the things they love. And yes, as much as I'm happy he doesn't have any back pain at work, I am more excited about the stories he comes back in and tells me about the peaks he climbed and the places he's been. That's what this whole concept of 100+ living is all about. If you were told you have a straightening of the lumbar spine, the goal of this video was to show you that there's a research-based, non-surgical way to address it structurally, not just manage the symptoms. You now see how we apply corrective lumbar extension traction in different ways depending on the patient's spinal degeneration and tolerance, so we can safely begin restoring the natural curve of the lower back. If you've learned something new or found value in this video, like it and share it with someone who may be dealing with chronic low back pain and does not realize that there may be a structural cause. If you have questions about straightening of the lumbar spine or about lumbar extension traction, drop them in the comments below. And be sure to subscribe if you want more evidence-based ways to correct your posture, protect your spine, and keep your body strong for life. And if you want to see the specific exercises we recommend to support correction of a straightened lumbar spine, watch the next video right here.